Hello everyone, this is Dr. Mac with my video number 8. Today's video is all about the clinical demonstration of the technique I was showing you guys last time for the class 4 composite, how to make that nice palatal shell. So what I'm going to do today is just to demonstrate quickly that technique. So as I said last time, if it's this side, you come from the opposite side, and if it's this side, you just come from the opposite side. It's all about that, okay? Because we are doing the distal, we will be coming from the opposite side. If you're doing the mesial, then we'll be coming from this side here. So just vice versa to that, okay? So let's work on that. Make sure you read the criteria really well, which is again one of the basics. If you still don't know about the criteria, it's very hard to understand any task or to pass any task. With the assessments, online assessments that I've started doing, I think a lot of people are getting it done, and I've been seeing more and more work in which when I show them the work, they're still not clear about the criteria. So it's very important that you keep watching the criteria, okay, and watch it really well, okay, and make sure you make your notes, discuss each and every point with your friends and stuff, and then hopefully you will be a lot better at it, okay? So again, as we discussed last time, that the thumb is a bit free at the moment, it's not completely tight, the finger is moving, and just to create that nice smiley, okay, once I feel it's nice there, lock your thumb in, get a ball burnisher going. Make sure instruments are nice and clean. So what I suggest before doing a class 4 composite, you should alcohol wipe all your instruments, your gloves. Best to wear new gloves straight away. And the best way to check your composite is from the occlusal view with the help of a mirror. So just with the help of this, so I'm not sure if you'll be able to see this or not. Let me see if I can try to see if you can actually, it's visible or not. I think it won't be very visible. But this is the way you check the smiley. From this view. This is the view you check your smiley from. If you try to see from any other view, you won't be able to see it. So try to have a mirror there, and try to have a nice look with the help of a mirror, and then will exactly replicate your smiley is gonna be good or not, okay? So again, with the same way, make sure your finger is moving, form that nice smiley. And once you feel the smiley is nice and good, that's the time you take your flow. Because we are only doing the palatal shell, the thing you need to understand here is it doesn't really matter if I have some space here at the moment. Can you see there's a space going on here? Because I'm just creating the palatal shell, I'm just focusing more on the smiley at the moment. I don't care about any other things because we're just focusing on the palatal, remember? Once the smiley is nice, ball burnisher there. And again, sometimes we're moving the hand, you know, you feel the smiley is gone a bit. That's fine. That's all good. Make sure you take the ball burnisher again, just free movements again, yeah? And we just want to form a very thin layer. I think I've got the wrong flowable composite. This is already set. So what I'm doing is just trying to make a very thin layer just on the palatal. I'm not doing anything else, just on the palatal. When I do my technical demos, whoever has taken my demos, online demos or one-on-one demos, I try to share 5 different techniques you can do the composite that covers every single task. Okay, so composite class 4 can be done in a lot of different ways, but this is just the basic method that you all should know before going to any other method. Let's cure this now. All right, that's what you need. Can you see that nice smiley there? That beautiful smiley there. See, this is forming, marginal ridge grooving in, and then again marginal ridge. That's what you need. It's so thin that if I want to break it, and even if you have a bit of air bubbles or something there, that's fine. My flowable composite is pretty old right now. Usually you won't have him, but that's fine for now. When you cover up the composite, it's just completely gonna cover up. Okay, once you feel you're satisfied, good. If you're not satisfied, for example, I'm not satisfied from this, that's okay. Boom, just break it straight away. Easy. Yeah. All right, let's try it one more time. Yeah, so again, come from this side. The only problem here is when I show you guys, I can't look very clearly because I have to look at the camera, otherwise you guys won't see, and if I can't see, then I cannot see half of the stuff I'm doing. But it's just basically to give you guys the concept. Yeah, again, see, nice smiley there with the help of a finger. Again, I would still suggest, no matter how good it is, just do a tiny bit of ball burnisher movement. Always nice. And this is very gentle movement there. Yeah, once you feel it's good, lock your finger. Let's go with your flow. Let's take a different move this time. Let's lock it there so you can see as well. Change the camera angle a tiny bit. Yeah, my composite, flowable composite is actually, I think it's expired or something. This one I got from eBay, which is a very cheap composite. I think I got these 5 flowable composite for like $10 or something. So this may not have a very good control with air bubbles or something, but still replicates the technique very well, which I want you guys to see. Yeah, make sure you don't forget the wedge. Wedge is very crucial. Okay, again, wedge is important to have that nice curvature from the start. Okay, now look at the thin shell there. You have that nice smiley going on. And that's what we want as well. Now the problem here is a lot of excess going on the adjacent tooth, excess going down as well. Here, this is all excess. Yeah, so that's why wedge is very important. Once you have a wedge in place, normally this thing won't happen. Okay, so let's try one with wedge. And I will show you guys the 4th one with the help of packable composite, because the only thing about flowable composite is you can't manipulate it very much. You just have to quickly cure it, otherwise it's going to keep flowing at all the wrong angles which you don't need. So again, Make sure to have the nice U there. If something like this happens, guys, make sure just use a new mileage strip. Okay, just make sure you use a new mileage strip. That's all you need to do. Let's get a new one. So again, composite, make sure tooth restoration junction should be clean, no excess going on, no overhang, nice smooth polish, highly finished, highly polished. It's a high aesthetic zone. Okay, criteria should be clean. If the contact's not good, it's all done already. Okay, no matter how good the composite is, the contact's not good, it's just useless. So I tell everyone, if the contact's not good, you better just not do the composite. It's the same thing. Because if you do a beautiful composite and the contact's not clean, it's a fail anyways, yeah? So, okay, here we are with the wedge. Smiley is there. Now when you lock the wedge, make sure you've already positioned it quite well, because you won't be able to move the mileage strip too much once the wedge is in place, yeah? So once it's nice there, make sure tiny bit with a bit of a stronger movement now, because the wedge is in place, so it's already locked. So if you want to think that the marginal ridge is not, you need a bit more sort of like embrasure coming out from there, just do it with a bit more force. And then once you feel if it's too much, just bring it back. Yeah, once you feel this is nice and good, everything looks controlled, go with the flow again. Just tiny bit more in my opinion, and try to get a thicker portion of the ball burnish. Okay, don't go with the smaller one, otherwise the marginal ridge won't be very good. That's I'm pretty happy with. Yeah, usually I think I'm never happy with anything, just feel like doing better and better every single time, but I think it should be sufficient. Make sure just having a thin layer. Now if you feel that you get a lot of air bubbles every single time, what's the technique? How to kill that? Take your periodontal, not the periodontal probe, normal sickle probe. This is a sickle scale, I don't have a probe for some reason. Just run it very gently. Once you run it, all the air bubbles are gonna go away. All you need to do, yeah? Now look at that. Nice smiley going on. Nice smiley going on. Lingual all clean, good. There sometimes if you don't hold the band very good, because I can't see it very well, I have to look at the camera. Look at what we have got, tiny bit of excess here. Yeah, but this easily will be wear off with it, just a touch of disc. Okay, but normally if you do it properly, even this excess shouldn't be there if you hold it very nicely. Okay, but it's a nice clean one, I would say. Okay, showing you guys from every different angle so you guys have a better idea. And as soon as you turn it, you can see the smiley a bit more pronounced there. Yeah, good. Let's show you the last one with the help of a packable composite. Yeah, I usually make very deep grooves, so it's just a lot stronger with the composites to stay in there. Okay, let's try with the last technique, which is with the help of a packable composite. So again, same. If it doesn't go in for some reason, just remove the wedge, because you're becoming too tight on one side, so definitely it's not going to go in. Yeah, So a lot of times you do things, just think a bit more logically and you'll find the answer. Don't need to stress too much about, oh, I've done this and I've done that. That's okay, you know. We all do mistakes and we all learn, okay? So that should be good, you know. If you do a mistake, that's fine. Just keep going, keep pushing, okay? And I think you all should be fine. Okay, so again, have that nice smiley going on. Nice grooves. Once I feel it's nicely there, good. Put the wedge in. It's so much easier in the jaw because this is moving so much. Now I'm so much comfortable doing in the jaw and not outside. And I feel majority of the time, a lot of people, when they ask me to do it inside the jaw, we can produce a lot better results. But then if I put it in the jaw, I think you guys won't be able to see. So see that nice smiley going on? That's all we need. Bit of excess on the side or something. See, if you tighten up too much right now because we're just creating the palatal, then you will lose this sort of like motion. So leave that there. If there's a tiny bit gap there in the interdental, okay, that's fine. Going to the gingival embrasure, that's fine for now because we're just making the palatal. We're not doing anything else, yeah? So once you feel you're satisfied, which I'll never be, but I think this should be sufficient. Let's take a bit of Packable Composite. And for this one, I would love to have a periodontal probe. See if, not the periodontal probe, normal sickle probe. See if I can find it. If not, so that would be the best thing. The only thing we're gonna fight is this. We might work with this for now. Again, my environment here is not very clean. It's not quite dusty here. So the composite will have a lot of particles attached to it, staining. So that's quite normal. Okay, make sure you clean your instruments and everything with alcohol right before you start. Okay, just to avoid anything happening. Once you feel it's nice and clean, again, try to have the nice smiley made there. Once you feel it's good, yeah. The reason I like Packable Composite so much, like you can do the class 4 composite in both. Either I would say using Palatal, the whole, like the flowable composite for the whole thing, or the Packable composite for the whole thing. It works really, really well for both of them. It's all about how you control it really well. My problem is I'm so used to working with loops now that now I can't see without the loops at all. This is still quite thick. You just need a very, very, very thin layer, okay? We don't need thickness at all. We're not working with thickness at the moment. We just want to create that palatal shell. That's all we need, okay? The good thing with Packable Composite is that you can control it. You can adapt it. Even if it goes at the wrong angles, you can bring it back. However, you can't do that with Packable Composite, with flowable composite, I mean. Packable, you can really control the outcome a lot better. With flowable, you can't. However, if you know how to use it correctly, flowable is a lot more quicker and still gives you very good results, okay? So that's the fourth way, or the other way of doing it with Packable Composite. Again, gives you beautiful results. Leaves very minimal excess compared with um, the flowable. Now if you look again, you have that nice thing going. Again, see a lot of air bubbles and a lot of air bubbles, but a lot of particles and blackening around it going. So that's quite normal. If you get something like that, just make sure, remove the whole composite. Make sure your environment is all clean. In the exam, I prefer to do the composite as the first task, because an amalgam possibly the second last or last, because we need to make sure environment is all clean for composite, and amalgam destroys everything. So make sure never do the composite after amalgam. And if you're not doing composite as your first task, make sure alcohol wipe all your instruments, all your gloves and everything, preferably very new gloves, so everything is nice and clean. Yeah, again, let me show you one more time. What you get in the exam, Gradia composite, it's very good composite. It has a very nice shine to it. All my pictures that I post on my page, that is Gradia composite. Usually I usually believe composite doesn't matter. It doesn't matter with the technique and all. However, if we talk about the finish and polish, that composite quality does matter a lot on that. Okay, and again, make sure if you have missed anything, you do it again. Make sure you build it again. I usually use a bit of Vaseline just to dip that my instrument in there, so then you can control it a lot more nicely. Okay, see, it's sticking to my instrument. So usually if you have a dip of Vaseline there, it won't, and it's nice and smoothing going on. And any excess there, you can just remove it now. That's the best part about Packable composite. You can play with it as much as you want. Yeah, and that's the probe there. It was there the entire time. That's like that's funny. Yeah, it was there the entire time, because probe is so thin. It would be just very nice to mold everything nicely. I'm just showing you guys a palatal shell and see how many minutes has passed by. That's why I usually tell people it's very hard for me to give you a demo for a crown or a complex composite or something, make a video on that, because just a palatal shell, and that's what happens in my demo as well. I'm showing so many different techniques that one demo just goes from an hour to 3 hours, 4 hours, unless I can give all the concepts I have in my head. And that's why preferably I prefer one-on-one demos. I don't like online demos, because I can't show them exactly what I want to. But it's still a better way of learning and getting concepts right, instead of not having any idea and practicing the wrong way the entire time. Again, you have the same technique there. See that nice smiley going on there? This is a bit of excess on top. You can just chip it off. Palatal going there. It's so paper thin that you can chip it off whenever you want. Smiley going on there. So that's the tip of the day today, guys. Just demonstrating the clinical technique for how it's all done. Take care of you all. Take care of yourself, and we'll see you all with another video. I think a lot of people were commenting on how good my canine was. I think canine is one of my favorite teeth to do. So usually I think this is not one of my best works. I can do more ideal with canines. However, I will share the technique how to make such a smooth margin going on, maybe in one of my next videos. All right, so hope this helps, and see you all again with another video. As I mentioned everyone again, that I've made the YouTube channel because so many people can't access on Facebook, and this would be a best platform for everyone to keep learning all the techniques at one place. Even if someone starts ADC process maybe 5 years later, or